Hello everyone and welcome back to the channel. My name is Dr. Grace. If you're new here, please like this video and subscribe for more medical videos. And if you're not new here and you're back, then welcome and I am so glad you stopped by. Okay, so a lot of men ask me when they're having prostate issues, Dr. Grace, what's even the point of this prostate being here anyway? The only thing it does is cause problems. Well, the actual main function of your prostate is help with semen production. Okay, I'm going to pause there for a second. So would you really rather not have a prostate then, based on what its main function is? Let me know down in the comment section below. Would you rather have a prostate or would you rather not? So having said that, when you do turn 50 or around your late 40s, then the prostate starts to act up. But by and large, it's giving you a good run, okay? But it does start to act up as you get older. So here are some signs that your prostate could be having some issues. And we are even going to talk about the big C word here. Cancer. Okay. So, number one is frequent urination. If you're realizing that you're having to wake up so many times at night to pee, anything more than twice a night really, you should be speaking to your doctor about it. It may be something else, but it may be your prostate acting up as well, especially if you're in that age group. Okay, another sign is weak or interrupted flow. Okay, so if you're realizing that you're having to strain so much just for a little stream of urine, so your stream is poor, but you're even having to push harder just to get that stream out, then your prostate could be in trouble. Okay, so it should not hurt when you're peeing. If you're finding that you're having a lot of pain, a lot of discomfort when you're peeing, then you should be speaking to your doctor because it's likely that you are having prostate issues. If you have any blood in your urine or semen, this is not normal, okay? Even if it's something as simple as a urinary tract infection or a prostate infection, because yes, you can get prostatitis, which is an infection of your prostate, okay? You should be talking to your doctor about it. You may need something as simple as antibiotics, or you may need further investigations. If it hurts when you ejaculate during sex, or if you're really struggling to even get an erection, then your prostate could be in trouble. Difficulty urinating is also something that could mean that your prostate is in trouble. If you have any issues starting, or have any issues stopping, or you just can't pee, that is a red flag as well. Now, the really dangerous signs are intractable bone pain. So if you've got severe bone pain, it's not explainable. Your back just hurts because prostate cancer will spread to the bones first. And many times you get a lot of people coming to the hospital with severe back pain that they just can't get rid of, even after they've had, lots of painkillers, lots of rest, lots of physiotherapy. This is something that we should be checking out, okay? Another sign of prostate cancer would be weight loss, okay? So sometimes prostate issues are annoying but not particularly dangerous, but unexplained weight loss and bone pain, like severe back pain, severe bone pain, severe joint pain that is keeping you up at night, these are signs that you could have prostate cancer and you should be talking to your doctor about it, okay? The other signs that we mentioned earlier, so like for example, bloody urine or pain during ejaculation or blood in the semen, this could be a sign of prostatitis, which we mentioned earlier, which is an infection in the prostate. And the other signs like straining to pee, very weak stream, starting and stopping, feeling like you haven't completely emptied your bladder, so feeling like you haven't voided completely, waking up at night to pee lots of times. These could be signs of BPH, which is benign prostatic hyperplasia, which basically means that your prostate was initially this small, now it's this big, and it's squeezing on your bladder and affecting your urine flow. Okay, the good news is that early detection is key and lots of these things are solvable. If prostate cancer is caught before it metastasizes, which means it spreads into the bones, then there's a higher chance of survival than when it has already spread. Okay, if the prostate is just large, like BPH, there are medications that we can do to sort of shrink it and relax the muscles so that your stream is better. If this doesn't work, then it would be surgery. So basically, what am I saying here? If you have any of those symptoms that we mentioned, again, to recap, any starting and stopping during peeing, poor stream, really straining to pee, peeing lots of times at night and in the daytime as well, feeling like you haven't completely voided, and lots of other symptoms, any bone pain, any back pain that you can't get rid of, any blood in the semen, blood in urine, these should just be checked out, okay? Just tell your doctor. They'll know what to do. All right? Make sure you get your PSA checked as well after proper counseling. This is because the PSA test is not very specific. PSA is prostate specific antigen, and sometimes when it's high, it could indicate that you have prostate cancer. However, so many other things could cause it to be high. Like, for example, if you have a urine infection or you have a prostate infection, your PSA would be high, and then you just get lots of biopsies and invasive procedures to rule out cancer, which you don't really need. Okay, so make sure you don't get your PSA without proper counseling from your doctor. All right, that would usually be the first step, along with blood work, for your doctor to really figure out what's going on. The sooner the better. Okay, if you've been having these symptoms for more than 4 weeks and you're still saying maybe it will get better, maybe it will get better, call your doctor now. Okay, I'm watching you. All right, if you've enjoyed watching this video, please hit the like button and make sure you subscribe to this channel. Share this video with your dads and uncles who could be having prostate issues. I would love to hear in the comment section below if you've even ever spoken about your prostate issues to your doctor. All right, I'll see you in my next video. Thanks for watching. Bye.